Today's lecture is going to cover the Dental Practice Act and informed consent. So those are our two topics for today. So our agenda for today, we're going to talk about the Practice Act, we're going to talk about informed consent, we'll go over sort of what homework and sort of what's coming next in the course. The objectives for today's lecture, so by the end of the lecture, you should be able to do these: explain how dentistry is governed, describe the process for changing the Dental Practice Act, contrast the Dental Practice Act in various states, and explain the components of informed consent and describe the importance of informed consent. So when we talk about the Practice Act, it's really about who governs and controls dentistry. The practice of dentistry within the United States. And the answer to that question is that the individual states, the state legislatures, govern dentistry in each state. And so what that means is the laws related to dentistry in Ohio might be different than the laws related to dentistry in Pennsylvania or Indiana or Kentucky or West Virginia or even over here in California. So all of the states may have different laws related to dentistry. That means it may take different things to get a license. That means it may allow hygienists to do certain things in some states, but not in other states. And so what you should know from this, sort of the star, highlight this point, is that dentistry is governed by the state legislatures. And so it's not a federal law or it's not federally regulated. There are some things that are federally regulated related to dentistry, but not the actual Dental Practice Act. That is a state, sort of a state's purview. So if you remember back from your civics or government courses, you'll remember the legislative, executive, and judicial branches of government. And so the state legislatures all have legislative, executive, and judicial branches. And the legislative and the executive branches are most heavily involved when we talk about regulating dentistry. So we're going to start with talking about the legislative branch. So this is, remember, the branch that makes the laws. And so the laws related to dentistry are found in the Ohio Revised Code. And so the Ohio Revised Code is a document that you can see here. And this is part of the Ohio legislative documentation and the laws in Ohio. And you can see that chapter 4715 is related to dentists and dental hygienists. And so it talks all about these different things related to dental hygienists and to dentists. And so these are written into the state's laws. And so you can see there's lots of laws that talk about dentistry. And these laws have all been passed by your legislatures in the state of Ohio over time. And these laws change through legislative action. So you can't change any of these without going through the approval process for actually changing the laws in the state of Ohio. And so, so that's how laws, get changed related to dentistry. So that is the Dental Practice Act, and that is in the laws. And so those things take a lot of work to change. They don't change very quickly, and have to go through the legislative process in order to be changed. Some of the things that are related to the practice of dental hygiene would be licensure requirements, what examinations are required to be licensed, who's eligible for licensure. Licensure by endorsement is related to getting licensed. If you're licensed in another state, can you just then transfer your license to an Ohio license? Approval of educational programs, examination and disciplinary authority, scope of practice, which means what you're allowed and what you're not allowed to do. Various supervision requirements related to dentistry and continuing education requirements. So the education that you have to maintain in order to keep your license in dental hygiene. So the executive branch is also part of making the practice of dentistry and regulating the practice of dentistry. And through the executive branch, there are rules and regulations. So a lot of these things are written into the statute through the laws. But there are other rules and regulations that maybe need to change quickly or change in a different way, and still govern the way we need to do dentistry in the state. And that happens through the executive branch. And the executive branch creates a dental board. And so in Ohio, we call it the Ohio State Dental Board. And this board puts forth rules and regulations related to dentistry. There are dental hygienists, 3 dental hygienists on the Ohio State Dental Board, and dental hygiene representation is common on dental boards, though the majority of representation is actually dentists who sit on the dental board. But there are 3 dental hygienists who sit on the Ohio State Dental Board also. They function to examine licensure, investigate disciplinary action, and adopt rules and regulations related to the practice of dentistry. So these laws and rules that are created by the executive branch are found on the Ohio State Dental Board's website. So they have a link to the Ohio Revised Code, and that is where those laws live. But there are also other rules and regulations that you can see, and policies that the dental board has. And so that's where these are published on the Ohio State Dental Board website. And those are the things that aren't state statutes, but are things you have to follow, and the rules and regulations of dentistry for the state of Ohio. So that's just a brief discussion of sort of the Dental Practice Act and where those regulations live. You'll need to remember that the state controls those, and so state by state things might be different. So if you're considering moving to another state, or at some point in your career you plan to move outside of the state of Ohio, you'll want to be aware of what the laws are within the state which you are planning to practice in. So our second topic for today is consent. And so you've probably heard the term consent before, and really what consent means is agreement. If you are entering into an agreement with a minor, it's called assent. And then someone may also dissent, which means you could disagree or not agree or not consent. And so those are some of the terms of consent. What we really want to focus on is informed consent. And so informed consent is what we would require to move forward with dental care procedures. Is patients are, have the right to be informed and consent. So to informed consent. And so the definition of informed consent is the right of patients to make decisions about their medical and dental care without their healthcare provider trying to influence their decision. And so that's sort of the general definition. You would need to know this. So if I said informed consent is, and I gave you some choices, you should be able to pick this choice out. So, make sure you star this one and know what informed consent is. There are 7 different elements for informed consent. And so you should also be familiar with these. The patient has to be competent to understand what's presented. The patient must voluntarily make the decision and not be under coercion. Material information must be fully disclosed. So the provider should be providing enough information to the patient so they can understand the procedure and understand the treatment and the risks that may occur because of the treatment that you are proposing. The plan for treatment must be clear. So you have to have a clear treatment plan. The patients must adequately comprehend the material information and the plan. So the patients must be able to comprehend it. And they must clearly make a decision to proceed with the plan. So they have to give their consent in some clear way. And the treatment plan must be authorized by the patient. So we in the College of Dentistry here have procedures in place that help you gain informed consent from your patients. And so we'll talk about those a little bit. These 5 here are, sort of the first part of getting consent. And then the second part is really sort of how do we actually show that they've clearly made a decision to proceed and must be authorized by the patient. How do we show that authorization? And we'll cover those things. Other elements that are in play when you are getting informed consent is that the provider must be knowledgeable. So you as must be knowledgeable about the procedure, able to answer questions that the patient may have. You must be truthful to the patient. The provider must inform of risks, benefits, and alternatives to the treatment. And so that information should be included and reviewed with the patient. The provider confirms that the patient understands the information. So you need to make sure that your patient has understood the information that you've provided, and they must be able to make decisions. And information could also include cost, number of appointments, those types of things, but it doesn't have to include that, but it frequently does include some of those things. When we talk about number 5, the patient must be able to make decisions. What we're really talking about is decisional capacity. So does the patient have the ability to make decisions? And decisional capacity is measured by patients being able to communicate a choice. They understand, they have some appreciation for what their decision is, and they can rationalize and reason their decision. There are some categories of people who do not have decisional capacity. So those would be infants, children, and adolescents, patients with extreme cognitive impairments or psychiatric illness, and unconscious patients. And so you likely will not encounter unconscious patients, as our clinic is an ambulatory clinic, but you may encounter children and adolescents through your pediatric rotations, and you may also encounter patients who have cognitive impairments or psychiatric illnesses that don't allow them decisional capacity. And so you would work with their either guardian or their legally authorized, person to consent for these procedures, because patients who do not have decisional capacity can't provide informed consent. So when we talk about what does this look like in the clinic, so the patients in the clinic actually will sign a general consent form when they register. And so they are provided that information and they sign a general consent form, which covers doing an exam and x-rays and a prophy and some of those types of procedures. But there are procedures that you may do that need additional consents. And so some of those might be, so non-surgical periodontal therapy, something like scaling and root planing. That would be part of, a consent that you may see that you would use within the clinic. You can see there's a lot of different consents that we have here in the college. I'm not sure this is the exhaustive list, but this is, part of it. If you're doing tooth whitening for a patient, they would need to sign the consent form, a particular consent form. So these consent forms you pull up the consent list in Axiom, and you choose whichever procedure you are doing. And when you do that, a form will come up and it says informed consent for non-surgical periodontal treatment. And these are just some screenshots of, this isn't the whole consent form. You can see there's 9 different points, and it describes sort of the procedure and what's happening, and then has some other language about the risks of the procedure, and often talks about who's going to be doing the treatment also. You would review this with the patient, and the patient would sign the consent form electronically on one of the signature pads, but they could review this on the screen, and it is also able to be printed within the clinics if a patient would like a copy of it. So informed consent is a really important part of, the care that we provide. And we are going to talk a little bit more about consent and how that ties into the ethics of dentistry and dental hygiene. So we'll talk a little bit more about that, but just knowing that informed consent is part of the process for proceeding with treatment for patients, and what sort of it takes to get informed consent from a patient. Just a quick course update. Your first draft of your paper is due tonight. After you turn it in, tomorrow you'll be assigned a paper to peer review. And so you will read a classmate's paper and you will give some feedback to your classmate to help each other out to make your papers better. So you're going to read someone else's paper and give them some advice and some comments that would maybe help to improve their paper. And then just don't forget, we don't have a quiz this week, but there will be a quiz next week, and it will cover this lecture and module. There will be one question from next week's reading assignment. So we will have a quiz at the beginning of next class. If you have any questions after this, please feel free to send me an email, or I am in the office, so I'd be happy to answer any of your questions that you might have about the content or the course. I hope you all have a great weekend.